Hello everyone, and welcome to today's presentation. I'm excited to have you here. Today we'll be exploring an important topic. What is the difference between EHR and EMR? On this first slide, I want to set the stage and give you a quick idea of what we'll cover. We'll look at the key distinctions between electronic health records and electronic medical records and understand why this difference matters in healthcare today. So, let's get started and dive into this fascinating subject. Let's start by talking about the introduction to electronic systems for managing patient health information. As many of you know, there are two main types: electronic health records, or EHRs, and electronic medical records, or EMRs. While they both serve the purpose of digitizing health data, they actually have different scopes and functionalities. The key thing to understand is that these differences often depend on the vendor businesses that develop them. Vendors may tailor these systems to specific needs, which impacts how the systems are used and what features they offer. Recognizing these distinctions is important because it helps us understand how these tools fit into the overall healthcare delivery process and how they can improve patient care. Throughout this presentation, we'll explore how these systems operate and their roles in enhancing healthcare management. Let's take a closer look at the scope of these digital records. First, we have the EMR, or electronic medical record. These are typically limited to a single healthcare facility, meaning they mainly serve the provider's internal needs. They contain detailed patient information, but their primary focus is on the care provided within that specific location. On the other hand, we have the EHR, or electronic health record. EHRs are designed with interoperability in mind. Their goal is to make data exchange between different healthcare settings much easier. This means that if a patient sees multiple providers or moves between hospitals, their health information can be shared seamlessly. Understanding the difference between EMR and EHR is crucial because it highlights the broader aim of improving patient care through better data sharing. Ultimately, while EMRs are great for internal documentation, EHRs support a more integrated approach to healthcare. This distinction is a key part of our overall discussion on how digital records are transforming healthcare delivery. Let's talk about interoperability, which is a crucial aspect of modern healthcare technology. When we look at EMRs, or electronic medical records, they are mostly used internally within a single healthcare provider or organization. This means they help keep everything organized for the providers within that specific setting. However, the real power comes with EHRs, or electronic health records. EHRs are designed to go beyond just one organization. They enable care coordination and continuity across the entire healthcare ecosystem. This means that patient data can be securely transmitted between different healthcare providers and organizations, ensuring everyone has the information they need. This secure data sharing is essential because it helps improve patient care, reduces duplication, and enhances communication across the board. So, in the bigger picture, interoperability is about making sure that different systems can work together seamlessly, ultimately supporting better health outcomes for patients. Let's talk about accessibility in electronic health records. First, EMRs, or electronic medical records, are often limited to the specific healthcare facility where they're used. That means if you're a doctor or a nurse working at a hospital, your access is usually confined to that location. It can be quite restrictive, especially in today's interconnected world. On the other hand, EHRs, or electronic health records, are designed with accessibility in mind. They can be accessed by patients and authorized healthcare professionals from multiple locations and across different organizations. This broader access helps improve coordination of care, patient engagement, and overall efficiency. The key takeaway here is that EHRs are built to be more flexible and accessible, which aligns with the overall goal of making healthcare more connected and patient-centered. This shift from EMRs to EHRs is a big step toward breaking down barriers and ensuring vital health information is available whenever and wherever it's needed. Source: AdjureMed.com. Let's talk about patient participation and how it's supported by EMRs and EHRs. When we look at EMRs, or electronic medical records, the focus is primarily on the needs of healthcare practitioners. They are designed to streamline clinical workflows and meet the requirements of medical staff, so the emphasis is mainly on clinical data. Unfortunately, this means that EMRs don't usually offer many robust tools to actively engage patients in their own care. Now, when we shift to EHRs, or electronic health records, the picture changes a bit. EHRs often include features like patient portals, which are really important. These portals allow patients to access their medical information easily, make appointments, view prescriptions, and even communicate directly with their doctors. This kind of engagement helps patients stay informed and involved in their health, which is a crucial part of modern healthcare. Connecting this to our overall theme, it's clear that while EMRs focus more on supporting healthcare providers, EHRs are increasingly designed to empower patients. Enhancing patient participation is essential for better health outcomes, and EHRs are a key tool in making that happen. Let's take a closer look at complete information in electronic health records. When we talk about EMR, or electronic medical records, we're referring to documents that mainly include clinical notes, test results, and prescriptions. These records are very patient-specific and focus on the clinical aspects that are directly relevant to medical practice. They help providers track a patient's health within a particular practice or facility. Now, EHR, or electronic health records, go a step further. They encompass not just clinical data, but also administrative and demographic information. This means that EHRs might include details from multiple disciplines, various care facilities, and different healthcare providers. The real strength of EHRs is that they provide a much more comprehensive picture of a patient's overall health. They help us see the bigger story, connecting different parts of the patient's care journey. So, in essence, while EMRs are focused on specific clinical data within a single practice, EHRs aim to give us a full, complete view of the patient's health history across multiple providers and settings. This completeness is crucial for making informed decisions and providing better care. Now, let's talk about reporting within our electronic medical record systems. When it comes to EMRs, there might be situations where we need to implement additional procedures or develop interfaces to facilitate data reporting and sharing with external entities. This ensures that relevant information can be communicated efficiently and securely beyond our organization. On the other hand, EHRs play a more active role in reporting services. They support quality improvement initiatives, health reporting, and data analysis, all crucial for enhancing patient care. Plus, they enable seamless data sharing with other healthcare institutions, fostering better collaboration and continuity of care. Ultimately, both EMRs and EHRs are vital tools for effective reporting, which is a key component of the broader goal of improving healthcare delivery and outcomes. This integration of data helps us make more informed decisions and supports ongoing quality enhancements across the healthcare system. So, in conclusion, while both EMRs and EHRs are essential tools for managing patient health information digitally, they serve different purposes. EMRs, or electronic medical records, are typically confined to a single healthcare facility and focus mainly on the clinical needs within that specific hospital or clinic. They are great for keeping detailed records for individual patients within one location. On the other hand, EHRs, or electronic health records, are more comprehensive. They're designed to be interoperable, meaning they can exchange data seamlessly across different healthcare providers and settings. This is especially important in Africa, where patients often move between different hospitals or clinics. EHRs enable better coordination of care because all providers can access and share up-to-date information. Ultimately, the decision between implementing an EMR or an EHR depends on what the healthcare organization aims to achieve. For example, a private hospital aiming for integrated, nationwide data sharing might lean towards an EHR system, while a smaller clinic might find an EMR sufficient for their needs. The choice should align with the organization's specific goals and requirements, supporting better patient outcomes and more efficient healthcare delivery across the continent. Thank you so much for your time and attention today. I encourage you to visit www.azurmed.com for more information and resources related to what we've discussed. And finally, I want to sincerely thank you for listening. Your interest and engagement are truly appreciated, and I hope you found this presentation valuable. Remember, the key points we covered today are all about empowering you with knowledge and tools to make informed decisions. Thanks again, and I wish you all the best on your journey forward.